Let's get middlemen out of healthcare and create a system that makes sense. I'm an ER physician and I'm on a journey to understand and transform our health system. This is my daily health systems transformation video. I do not understand the finances of our healthcare system. I'm not sure that anyone does. I've been watching and listening to a number of videos by Dr. Eric Bricker, an internal medicine doctor that creates these videos called A Healthcare Z. I'll provide a link to those. And I think that's helpful. I do recommend those videos. I have absolutely no link to him whatsoever. I also recently read an article on health affairs. The article's title is The Incursion of Profit-Enhancing Middlemen in U.S. Healthcare. This is a part of the finances of healthcare that I'm just learning about, and it's really quite mind-boggling how middlemen are maximizing profits because of the complexity of our healthcare system financing in a way that harms all of us. I will provide a link to this article, but you may have heard of pharmacy benefit managers, or PBMs, or third-party administrators, or TPAs, or revenue cycle management, or claims management, claims repricing. So this article goes through how providers use profit-enhancing middlemen to maximize reimbursements per claim. It goes over profit-enhancing middlemen make money on both sides of post-claims insurance claims denials. And then it just talks about how the way that we finance healthcare is so complex that hardly anyone understands it enough. And so people can jump in and make tremendous profits in the short term in a way that undermines care. It undermines the finance of individual citizens and increases bankruptcy, etc. It also harms our nation as a whole because of our national debt. Here's the way I understand things. Over time, we've tried to hold two truths. So the one truth is that government should not be involved in our healthcare, that the relationship between physicians and patients is sacred, that people are responsible for their own health. And so we should keep government and regulation and healthcare financing out of healthcare. On the other extreme, over time, we have realized that we as a society won't support people dying in the streets. So we created laws like EMTALA, where we have to give emergency care. We've come to the conclusion as a society, we've made a social contract with our people that health and health care is not so simple as an individual choice, that we are born in different situations, that we have certain conditions that come up, that there are structural inequities, that we all, that our health status is more of a collective affair rather than strictly an individual affair. So we've come up with patchwork solutions over time: Medicare, Medicaid, employee-based insurance, just a number of laws over time that, when taken together, don't make sense as a coherent system. We don't consider the interrelationships between these various laws and procedures and policies. And so we can have middlemen that come in and take advantage of this system. We need a complete overhaul of the system. We need to think of it as a system, consider the interrelationships. We need systems, champions, and advocates that can advocate for and champion a new historical transformation in our entire system. I'd love your thoughts. Thanks.